Question 85. Which of the following lab patterns would most likely be found in this patient? PTH, calcium phosphate. Cool, it's a calcium homeostasis question. I feel like this is the third one I've put in this self-assessment. Sorry. A 45-year-old man presents to the clinic after several weeks of persistent dry cough and mild chest discomfort. He denies fever, weight loss, or recent infections. His past medical history is unremarkable and he does not smoke. On physical exam, he has clear lungs without crackles or wheezing. Chest imaging reveals bilateral hilar prominence. A biopsy of mediastinal lymph node demonstrates non-caseating granulomas. You say caseating or caseating? Tomato, tomato. So this is a pathognomonic setup they've given us. They really did give us the whole bag here. It's just maybe not quite the exact demographic you would expect, but this with a bilateral hilar prominence is a strange way to say it, but this is sarcoid. Typically, we would expect this in middle-aged females, especially middle-aged African-American females. But again, NBME and COMLEX are breaking away from the ethnic stereotypes. So expect to see any autoimmune condition in any person. So the next question is, how on earth does sarcoid impact anything to do with calcium? The non-caseating granulomas of sarcoidosis have a lot of 1-alpha hydroxylase. So 1-alpha hydroxylase catalyzes the conversion from 25-hydroxyvitamin D to 125-dihydroxyvitamin D. Di means two. And who said undergraduate chemistry was useless? Ha! Not me. Or in other words, this is the inactive form to the active form. So sarcoidosis activates vitamin D. This is the active form of vitamin D right here. So I'm going to start with this column. I know this is going to be up. So A is out, C is out. Next up, what does vitamin D do? If you don't already have the calcium homeostasis feedback loop memorized, you really should, or at least a very basic version of it. So active vitamin D comes down here, works on calcium by increasing it and increasing phosphorus, as opposed to PTH, which does things a little differently. First off, PTH activates vitamin D, but then it also increases your calcium and decreases your phosphorus. And that's an important point. Everything in the middle involving the kidneys and the GI tract and the bone, that's a little less important to memorize. If you have this down, honestly, that is probably going to get you through quite a few questions. You just need to know that the effector organs that this stuff works on would be the kidneys, the bone, and the GI tract. And it's the kidneys responsible for excreting your phosphorus. All right, so we know our 1-alpha hydroxylase in our sarcoidosis is going to cause increased calcium and phosphorus. So calcium is going to be up, which means it can't be D or E. We already have our answer. Have we confirmed phosphate is also increased? Perfect. And PTH, let's just confirm this. PTH is low in this answer choice. Would it be low here? Well, what we haven't drawn in yet is the negative feedback loop. High calcium is going to negatively feedback on your PTH, all the same that low phosphorus would. And so if we have high calcium, technically high phosphorus would positively feedback on PTH, but high calcium would not. So this would join us over here and negatively feedback on PTH. And that's why the correct answer is B.